Um, and today is a very, very special occasion because we actually have our nursing leader, who is the chief nurse from the World Health Organization, Amelia. And when you have reached legendary status when you are just known by your first name. And this is the thing, everyone knows Amelia. That's it. She doesn't need anything else. It's like Tedros. There is just one name and we know who she is. So it's absolutely wonderful. I'm so, so delighted. I can't tell you. And I'm so delighted for you because this is your opportunity to listen to Amelia, to meet her, to think about what she's saying, and to ask any questions that you have. So Amelia is here. You can see her looking gorgeous there, and with the wonderful WHO Health for All logo behind her, which is just so beautiful. And we'll hear from Amelia shortly, just while everyone continues to join. Amelia will talk for about 10 minutes and then there will be a chance for some questions. You can put your hand up or your question in the chat. At the moment, everyone is muted. We'll then go on. Then Amelia may have to leave. Obviously, she has lots of other business today, but she'll stay as long as she can for us. Now, we will hear from myself about the Nursing Now Challenge. Oh, there's Francisca. Hi. Hello. Oh, it's wonderful seeing all our gorgeous colleagues and chief nurses joining. It's wonderful. This is great. Great support for us. And then we'll hear from the Challengers Committee, one of our very certainly vibrant communities that we have within the global network. And Amy Staley, who you will know, she is Challengers Committee co-chair and a Nursing Now Challenge board member. We'll hear from her. And then we're going to hear from a couple of our colleagues, Harriet, who I really like how Harriet calls herself Nursing Now Challenge Success Story. And Harriet's a midwife. And remember, we're not all nurses. Also, we are nurses and midwives community. So we'll hear about her entrepreneurship, her innovation, how she has taken an idea and made it that dream she had, and she has made it a reality and a success and is very inspirational. Then we'll hear from Ernest, who is our Southeast Asia Regional Hub Lead. Then we'll have some more times for Q&A. So some of you will not be members and thinking about joining. Some of you will be members and just are joining today because you want to hear what's happening and listen to Amelia. And we thank you for your time. So I'm going to hand over to Amelia, who needs no introduction. And I have been lucky enough with one or two of you to have the chance to meet her in person several times, and our conversations are always wonderful, and I can tell you she's just a joy, and has a great sense of humor, and has a real passion for early career nurses, and has been doing transformational things at WHO. The global community of practice is vibrant, it's growing, and she is really leading this change now, and she is about action and let's get the youth going. So we share many similar hopes and dreams with her, and she requires our support. Every one of us has to support her because she's representing us at the highest level. So Amelia, over to you. Thank you so much for your time today. Welcome. Please clap. Yes, people clap.
Thank you, Professor Aisha Holloway, for the very warm welcome. How can nursing and midwifery leaders actively participate in policy dialogue, be influential in policy formation, influence decision-making, and contribute to effective health systems and universal health coverage? Your Nursing Now Challenge, championing and investing in leadership development around the world, is key. My strategic direction focuses on global advocacy, raising the profile of nursing and midwifery, nurturing future leaders, and the 25 by 25 basic emergency care campaign that aims to improve access to BEC training for nurses and midwives in 25 countries by 2025. Leadership is one of the 4 policy focus areas of the WHO Global Strategic Directions for Nursing and Midwifery 2021-2025. By fostering leadership, we empower you, students, early career, and all nurses and midwives to take on pivotal roles in ensuring safe and quality care and transforming healthcare and academic systems. Evidence shows that whilst women comprise almost 70% of global health workforce, they only hold 25% of senior roles in health organizations. Absent of women leaders at the policy table, including contribution from nurses and midwives to policies, weakened overall progress towards universal health coverage. This should concern all of us, and especially you as potential future leaders. Last year, the 2023 Global Monitoring reported on tracking universal health coverage. It clearly showed an alarming picture on the state of universal health coverage around the world, where about half of the world's population, this is 4.5 billion people, was not covered by essential health services. Your influential leadership is vital to closing the gaps with access to care, especially for vulnerable communities. The 77th World Health Assembly this year approved the General Program of Work 14 with an overarching goal to promote, provide, and protect health and well-being of all people everywhere. 2 of its objectives are advance the primary healthcare approach and essential health system capacities for universal health coverage, and improve health service coverage and financial protection to address inequity and gender inequalities. These 2 objectives cannot advance without contribution from nursing and midwifery and long-term investment in nursing and midwifery. We are also working with Nursing Now and all our partners towards development of the State of the World Nursing Report 2025. Let us all together seize this opportunity to advocate and strengthen national, regional, and global partnerships, especially with our communities, with politicians, financing and business sectors, to scale up long-term investments in quality education, jobs with fair remuneration, and influential leadership. From my previous experience in Tonga in 2021, despite the COVID-19 pandemic, we were still able to finalize and present the Nurse Practitioners and Midwives Act 2021 and was approved in Parliament. This was the first ever piece of legislation that recognizes nurse practitioners and midwives. I wish to share a Tongan concept known as whakawhitaauli. This is a concept from engine navigation at seas, where navigators encounter stormy weather for some time, and all sailors are exhausted and have fallen asleep. The captain of the boat realized that despite his own fatigue, he is the only one to stand up and steer the boat for the survival of everyone. There will be times like what I have experienced at executive policy tables that one must have the courage and humility to stay on the course and negotiate for the long term despite all oppositions, because it is the right thing to do for the population and the professions. Professor Aisha, students, midwives, and nurses, I look forward to the impact of your influence at the decision-making tables around the world towards better health and well-being for all people everywhere. Merci beaucoup, Malo Alpito, and thank you very much.
Hugely inspiring. Amelia, thank you so much. I've just noticed that in the chat, I think I'm trying to see who it is, but they have just said this is very inspiring. And I think it is. That's wonderful. I think the great thing is you've managed to pull everything, all the key important messages and elements together, and be clear about why they're important, what you need from us, and what we need to do to push forward, make change. And I love how you started with the idea of nurses influencing policy and the advocacy. And I know you are so passionate about that. It's the fire inside you, and your story of how you made it to your role in Tonga, and a woman amongst many men, and were able to just forge that path. And that's what's very inspirational for everyone listening today, because they sometimes don't believe it's possible. And then they hear from you and they realize you are a nurse, you are like us, we're all the same, we're in our job because of what it means, what it stands for, what it contributes to society. And it's possible. It's possible for every one of us to be that person, to make the change and to influence. And it's just that was such an inspiring keynote. I'm going to listen to it again. I'm going to use it. Actually, I'm going to let my students listen to it in the university. And I would suggest everyone listening today, because this will be available recorded, please share it with your colleagues, share it with your friends. When you're together thinking, what is the way forward? Where is the light? Who is our leader? What are we listening to? This is what they need to listen to. This. And working together and cooperating and partnership and supporting each other is the only way we will do this. So we are so grateful for you, Amelia. I'm going to just move to see if there are any questions. I'm just having a wee look in the chat, or if you would like, just pop your hand up. So Rachel Kennedy has put in this chat, we operate within such a risk-averse environment within healthcare. How do we inspire creativity and innovation within our nurses, particularly our early career nurses? Amelia, how do we inspire our early career nurses? I might just say join the global community of practice and join Nursing Night Challenge. But Amelia, what are your thoughts about how we inspire them? Because you've had these conversations with me and others, I think.
Mhm.
Great question. Over to you, Amelia.
Uh, Thank you very much for a very important question. And I think this is for inspiring for everything. I think, teamwork, we must come together
Mhm.
and have a conversation and have an in-depth conversation and dialogue with regards to the issues that we face. We must come together, have a deeper understanding of the challenges and the issues that we face. And from there, I believe that nurses, with the experience that they have at the front line, do have the solutions. And let us work together with all our teams to see a sustainable long-term solutions for the challenges that we have. We
Mm.
must come together as a team, and of course, within ourselves first, before we engage other people within the health systems. And of course, outside the health systems, we need to work together with politicians and economists and other key players within our national and regional context.
Mm, yeah, yeah. I mean, absolutely. That coming together, a bit like we're talking. Amelia saying she's working with different organizations, different partners. There's the ICN. There's lots of pockets and communities who are working, but it is about working together.
Mm.
And I know, Amelia, you've said before, the nurses on the front line are the solution.
Mhm.
And it's
Yeah.
easy to think that the people in these big senior roles are having these conversations. And Amelia is really strong on this one. She's like, no, 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 that can be happening. But the frontline workers have the solutions and we have to connect with them. So I think it's that connection, isn't it? And working together. And the global community of practice that's been set up, it's growing. Similarly to Nursing Now Challenge, it's about creating that critical mass of youth, of early career, or frontline workers, even if you're not early career, because we know that nursing itself has this glass ceiling always, within different levels and grades. And how do we have that opportunity for development? And hopefully the global community of practice, the initiatives that Amelia has, the emergency training, all these things are resources that are available for you to engage with. And don't be afraid. You will come into a community that is very caring and wants to support and lift you up. And I see in the chat, Hazel has said that the Challengers Committee opened a lot of opportunities for me, from knowledge to social connection to getting in the group who share the same passion. That's it. Get that energy from each other, like we're doing this morning or this afternoon or this evening, wherever you are in the world. Um, Rachel said, thank you so much. You're so right. Nurses on the front line are the solution, Amelia. If you have any other questions, please pop them in the chat. We'd love to hear from you. Hi all, to be part of your plan and future endeavour for nursing. Many thanks to our WHO, Amelia. Thank you so much. Okay, yes, we are so grateful for you. So I'm going to leave the chat open. Amelia, we would love for you to stay, but we understand that you may have to leave. We're going to, oh, Amy has a question. Sorry, Amy, you're up in the
No,
corner.
that's
Okay,
okay.
Amy,
That's okay.
yes,
Thank you so
please.
much. Thank you so much, Amelia. So my question was, I've been a nurse for maybe about 5 years now. And when I first became a new early career nurse, I think that my expectation was that I was going to be so shocked by everything that I saw in the hospital and just being exposed to so many different things. But then as my practice grew, I found that I was more surprised by all of the inequities that I saw, within other areas of the world, one of which that you mentioned today, that was so surprising to hear. And seeing that only 14% of community health workers in Africa are paid, and seeing that nurses across the world don't all have the resources they need to safely do their jobs. So my question for you is, for those of us who do have a platform to advocate and who are a part of the Challengers Committee, what's the strongest way that we can advocate for these other communities that maybe don't have that platform to advocate for themselves?
Okay, thank you, Amy. So, Amelia, hopefully you got that. How can we, in our communities where there is some success, how can we advocate for our colleagues in other places who maybe don't have those same opportunities?
From my personal experience, it's about empowerment of the local people to advocate and lead advocacy within their own systems. That is, for me, very important. Of course, we can do advocacy for them and at regional and global stage, but it is very important that we support and strengthen local leadership to lead the way with regards to these challenges that they face on the ground and with inequity.
Thank you.
Yes, perfect. That's it, grassroots, isn't it?
Yeah.
Grassroots, yes, yes, for sure. And there's a few other things coming up. Someone's asked what leadership and advocacy platforms have been created by the WHO CNO for student leadership development. There's quite a few that are going on within your team, Amelia. Are there any that you want to highlight for student leadership development?
We have a future leaders group within our global community of practice, and it is still a work in progress, slowly developing, but that is a good start. And of course, leadership program with ICN and our partners around the world.
Yeah, lovely. So that those things are there. So please join. And I think the other thing I find is that nurses are maybe, and maybe midwives also. I'm not a midwife, so I can't speak as a midwife, but nurses and early career nurses are often, because of the education that we experience, it's still not really the message that we need to be brave and we need to go for it. We're always a bit reticent. So we join these things and then we wait for something to happen. And the thing is, you have to make it happen. You know, you join and offer yourself, be engaged, connect with people, feel brave to reach out, because nobody is going to give us permission. We have to take ownership ourselves. And I think that's the thing. It's about believing in yourself. And once you take that leap of faith and you have everyone around you in your community, that then gives you that feeling that you can do it. And when there are setbacks, we are there to hold you. So, you know, joining is the first step. The most important step after that is then what you do in your WHO Global Community of Practice. Be an active member. Don't wait for that permission. Okay, and there's just a few things in the chat there about the challenges of health worker attacks and the security of health workers being important and how to face this challenge. I don't know if you want to say something about that, Amelia, and someone saying thank you for the health education material that is being available from your office. That's from someone in Egypt and Cairo. So I think we'll finish with that last one about the problem of health worker attacks, which we're seeing globally, aren't we? And how to face this challenge. And I mean, that's a challenge not just for the CNO's office, that's a challenge for WHO and all of us. But Amelia, I don't know if you have a comment on that.
Well, you know, it's absolutely wrong
Yes.
that nurses and midwives and healthcare professionals are attacked. We, WHO, have made a strong stance on that. But of course, we need to come together and support each other within such a challenging environment. Mhm.
Yes, yes, yes. Yep. And people
Mhm.
just agreeing. We've got people just joining still. Lecturer at higher education institution in South Africa. I agree with that. We need to strengthen mentorship and support. Actually, Nala is from Sudan. And yeah, we've got a few more. Okay. Nala has got her hand up. Okay, last question, because we do need to move on. Nala, are you able to have your question?
Yeah, please. Hi, can you hear me?
Yes, thank you.
Hello, can you hear me?
Yes, Nala, we
Okay,
can hear
thank
you.
you, Professor. Welcome, Amelia, and all the team. Thank you so much. I'm Lahis Suman from Sudan, and currently I'm in Egypt because of the war is still ongoing. And as I face problem of the internet, so I moved here. So now we do have an outbreak for cholera. You know, all the disasters issues are there. The war, the crisis now, it is the raining season, which is there is a huge flood and there is a huge damage of houses and people displaced, plus the outbreak of cholera. So I do communicate with our nurse over there uh, to participate in the community, but there is still all the issues, the problem are there. So what I ask a recommendation, if Dr. Amelia, I mean, like mainly, I just do ask that if possible, if you would recommend me with the material from your office, I could start to do teaching online for them as instructions with the WHO logo, as your office is participating on that. So we'll have a lot of materials being delivered, a lot of messages reach out in spite of there is no transport and the road was being damaged. So at least the message is there. As well, we can make it as a research. I don't have a problem. You give me the ethical approval and we go for a research. Let us have it as outcome because this is 5 crises are there. Disaster of the war, disaster of the climate change, and outbreak of a disease. Thank you.
Thank you, Nala. I'm just going to step in there because I think that's these are hugely significant challenges. I mean, these are out with anybody here on this call's kind of remit to kind of action. However, you've raised these important points, and what we will do is we can take these details and we can pass them on to colleagues at WHO, not just Amelia, but our wider colleagues who are actually dealing directly with the emergency responses. We do that. We've got a lot of our nurses working. We've got a lot of Sudanese nurses, and we link in with them so we can take these issues that you're raising and pass them on and your details. So we'll work behind the scenes with you on that one to connect you with the right people. But thank you so much for raising that point, and it is hugely important. And one of our future pieces of work actually that we're working on is how do we support nurses in conflict zones. So that is something that maybe even Amelia and I can have a catch up about also. So really important, and thank you so much. If anyone has got any questions, send them over and we will get them answered for you and put them back out there. But we're going to move on now, if that's okay. Thank you so much, Amelia, for being with us this morning, being hugely inspirational. And can we just do a little round of applause if you put your cameras on, please? Thank you, if you can. And one last clap for our wonderful Amelia. Thank you so much, Amelia. And we appreciate you. And Nala has put thank you so much, highly appreciated. Thank you, Nala. Okay, so we are going to move on to a little quick presentation on Nursing Now Challenge. I think that's what is next. Is that correct? Is the slides are coming on? So if you're not already part of Nursing Now Challenge, I'm going to tell you how you can be, and then we're going to hear from some of our amazing people who make this happen. So can we have the next slide, please? This should be coming. Okay, so today we have, I'm just going to move this. Now, I'm just going to give you a little bit of a background that's going on here with the Nursing Now Challenge team, Hannah, Faye, myself, and the board, and Amy, etc. We are moving to a different platform to manage our network because it has grown so big, and we need a platform that is able to function at a higher level for us to engage with our regions. As Amelia said, that grassroots level. So our regions are really being strengthened at the minute with our co-chairs. We have one region that needs a couple of more co-chairs, and then we're doing some education, training, development work with our regional co-chairs. We're bringing our board much deeper into our regional hubs. So to facilitate all that, we're moving to a different platform, and that means that we're saying our numbers are 62,000, but they certainly are not. But we are, inside scoop coming. There will be an announcement at some point, an update on those numbers. But for the moment, we're sticking with what we've got. It's a lot of organisations around a lot of countries. But we will be coming soon with some big news on our the size and scale of our network as it has grown over the last 2 years. Next slide, please. So membership is totally free. These are the key messages. If you're joining us today and you're an individual, you can join. And if you're an organisation, you can join, and your nurses and midwives will be able to be part of the network, and we can do both things. If you are an individual, we will work with you, as well as your health employer, university and colleges, to join as the institution. We always find it's great if the institution is joined up, also with Nursing Now Challenge, and then that spreads that information, that knowledge, that opportunity, and then you start growing the number of people who are exposed and who can access the resources. So if you would like to join your organisation, we can support you to do that. We can provide you with guidance on how your institution can get involved, but as individuals, you can join. Next slide, please. So what is Nursing Now Challenge about? We have a mission and a vision of bringing together the world's early community, a community of early career nurses and midwives who will really shape the future of our profession and deliver, healthcare, public health, prevention, rehabilitation, all those things, but also advocacy for our patients, for our profession, and innovation, entrepreneurship. I mean, really, we are empowering you to be the best version of yourself and to be the best version of nursing. How Nursing Now Challenge webpage, and you click on the button, you put your details in, and you are joined. Now, I'm hoping you can still hear me because it says my internet is unstable. So we offer 4 things. I'm trying to capture, we offer more than 4 things, but in a nutshell, resources that you can share with your colleagues, but use yourself for knowledge, information, and resources from across the globe in the global network. Networking. Because we have such a great reach, not just within our own network, but with other organisations, for example, the WHO, the ICN, different Sabin vaccine, we are networked with many other external organisations, and you have the opportunity then to be part of that, both online and in person within your own local area, your region, or globally. We have leadership development opportunities, whether that be through education or through opportunities of our Global Solutions Initiative, or being part of panels, or being invited to certain events, or taking on a leadership role within Nursing Now Challenge. You can do that. you can be a member of the Challengers Committee, and I'll tell you a bit more about that later. And research and innovation, we're doing a lot to develop and accelerate research awareness, the development of nurses leading evidence-based work, so that we as frontline workers can see what is going on, what the challenges are, and we can develop the evidence base for the evidence-informed solutions. So that's kind of it in a nutshell, our 4 foundational pillars. Next slide. And we have an advisory board. This is a formidable team of dedicated global nurse leaders, who many of them were with us when we were nursing now. And we have nurses, we have non-nurses, and they are absolutely the most wonderful people, hugely supportive. They are in very senior roles globally, and they help us to steer the direction of travel, and they are placed regionally, which means that our regions have this leadership available. And we have a great initiative that we have just put in place, again, to strengthen the regions. Each advisory board member has been invited to nominate another nurse or midwife who they work with within their region to work with them on the board. So they're not board members, but they are supporting them, and they will be supporting the work of the regional hubs. So we're just doing that at the moment. All the advisory board members are busy letting us know who these people are, and they are volunteering to do this, but it's just about creating another layer of individual who will be able to support the regions where we really want the work to happen. Next slide, please. And here's the rest of the world. And obviously we have Amy and Clarissa, who are our Challengers Committee co-chair leads, and they are just absolutely wonderful. Clarissa's just about to step down, and we are looking to appoint a new one. Next slide, please. We're going to have, I think, a look at the Challengers Committee. So we have this huge community, and within that we have the Challengers Committee, and we want to invite you to join that. It's part of the Nursing Now Challenge. It's run by you, our members, and these are for people who want to be more active rather than just getting the information, attending webinars, debates, all the resources that are available. If you feel you want to do more, this is the place you do it in. So we are offering a platform within Nursing Now Challenge to help you really forge forward and really take on issues and actively support the agenda within your country and region. So let's find out what that looks like if you're a challenger. This is our regional hubs. We mirror the WHO. We have 6 regional hubs. These are our regional hub leads. And you'll see Western Pacific is the one that we are actively looking to recruit to. So if you're a member now and you're keen, then please get in touch with us. Eastern Mediterranean, Sana, I know, is on the call today. And as another success story, Zabin as well. Those 2 are really taking this by the scruff of the neck, and they are getting the EMRO region really up and running. We've got some really strong representation in Africa, Americas, Europe, South Asia. In fact, Western Pacific, they are doing a webinar shortly, actually. So if you're in that region, please look out for when that webinar will take place. Next slide, please. And Ernest, Southeast Asia is on there. So this is who they are. This is who they look like. And thank you so much to these people, because they are doing this because they just want to. And they are leading the regional hubs. So this is Africa. And let's go to the next slide. And I think we've got the Americas. And then we've got EMRO region. Next slide. Euro region. Next slide. Southeast Asia, Ernest is there, and Western Pacific. Yep. Okay, next slide. So what did they say about being members of the Challengers Committee? Next slide. Andreas. So there he is at the UN flags, telling us about what it was like. An incredibly rewarding experience, inspiring, having the opportunity to be in the political arena. He came to the World Health Assembly with us. He couldn't have imagined a few years ago when he decided to enter nursing and now making a difference, how this was possible. And he's not long registered as a nurse. He was a student when he joined us. So there is no time like the immediate now in joining and being part of this. You can do it. Next slide. And then we have Zabin, who has said it's been an incredible journey. She's organised many events, which is wonderful. I mean, this is the thing. If you want to see change happen, be part of that change, make that change happen. Don't wait for permission. So here's the thing. This is what's happening in the Emro region. The Nursing Now Challenge team is truly supportive without any barriers, which I love. Next slide, please. It's Amy Horcasitas in South America. And Amy is actually not only involved in Nursing Now Challenge, she has many organisational roles that she's part of and networks. So it's not just about, well, I'm only involved with Nursing Now Challenge. What else can you be involved with if you have the time, energy, and space? Next slide. And here we have a few other pictures of the team. Actually, there's Harriet up there. Next slide. Okay, are you a challenger? So we invite you to join the Challengers Committee. If you want to play a more active role, please get in touch with us. Challenge at Nursing Now Global. We see Dr. Tedros there, meeting a group of us who went to the World Health Assembly last year. Next slide, please. And I'm just going to whiz through some of our ongoing events and resources. All of this information is available on our website. Someone said, could you please confirm whether the application for the Challenge Committee is still open? Someone will respond to you in the chat there. Next slide. Let's whiz through. It's just some of the things that we've got available. We are part of the Sabin Global HPV Consortium. I mean, there are hundreds of partners within this. This is so huge. If you're on social media, you will see Sabin is a major vaccine player. HPV is one of the largest causes of mortality, of morbidity in women in the African region particularly. And we are one of the few workforce consortium partners. We are running a global solutions initiative with Sabin. It's coming up. It will be launching, I think, in September. So please look out for it. And you'll find out more on the website about what global solutions initiatives are. Next slide. Oh, Nala, you're on the second course of HAT training. Brilliant. Global Solutions Initiative. Oh, here we are. Yes, in September, we will run a new one. We've just had one on misinformation and disinformation. And I was on a really interesting call yesterday with WHO and other governments around how governments around the world are really, really taking misinformation and disinformation seriously. And we were particularly talking about health workforce. So it's probably something that we might pick up on again at a later point. How we could participate in HPV. If you want to participate in the HPV work and you're a member of Nursing Now Challenge, please just get in touch with Hannah and Faye. Just email us. And we will let you know how you can be part of the work we're doing there. Health action training. I think we're going to listen to this video if that's possible. Oh, it's not. Sometimes it does usually work. What we can do is, I think it is on our website, so we will send an email that links to this actual video because it's great to listen to. Health Action Training is a leadership course that's available online. It's absolutely amazing. It's wonderful. I've done something similar to this, and it's really about bringing yourself to the table. Nala's saying she would really recommend HAT for all nurses. It's free. It's wonderful. You can just do a straightforward one session, or they actually have an accredited, more intensive training. Please do it. It is absolutely wonderful. Next slide, please. Health Action Training. It's on the website. Sign up and you'll get an email about it. The 1000 Challenge is about our research work we do with the Global Health Network, research capacity building. And again, the information is on our Nursing Now Challenge website. If you want to know more, please get in touch with us. And then we have the debates. These are yeah, people are putting about hat great in the chat. So the debates are really our series of events that we will hold. They're a webinar format, but they're debates because we want to have discussion. And we are about to hopefully have quite an exciting debate coming up. We're just firming it up. It will be workforce focused and looking at the research evidence behind safe staffing, what that workforce needs to look like, etc., by some of the leaders globally who are undertaking that work. So we're just having some discussions about that. All these other topics are up for discussion about what we want to talk about. If you're really interested in being involved or want to suggest some, please let us know. Next slide, please. The book club fits in with some of the debates. We've just done a book club with Catherine Trebeck, The Economics of Arrival. You can watch these again on YouTube. And our forthcoming one actually is a homage to Lord Nigel Crisp, who really was the founder of Nursing Now campaign with Tedros, with the ICN, with Jim Campbell. They made it happen, really. And he has got many books out around health. So we thought, let's invite him back to the legacy, which is Nursing Now Challenge. So his one is coming up soon. I think it's also in September. I think it's September the 5th, if I'm right in thinking. You can sign up. They're great. And we have our young nurses in asking questions and debating some of the challenges. And I think what this is important for, if you think, oh, book club, is that really for me? You don't really have to read the book, but what is really useful is understanding how to critique, how to debate, how to have a verbal discussion, how do you negotiate, how do you unpack some of these big challenges. And if you want to influence and if you want to engage in advocacy work, you have to be able to articulate what it is. And you need to have done a bit of reading, you need to have clear idea in your mind. So they're really useful for you to come and join and listen to and think about, well, what would I say if someone asked me what the challenges were? Where can I get some ideas from? How can I listen to others? And we use it as an opportunity of leadership development for our young nurses who get the opportunity to interview the author. So come along to that. Very informal, but great fun. Next slide, please. Yep. Oh, 5th of September, 2:30 British summertime. Next slide, please. Great. I'm just mindful of the time. Good things are coming. This is a list of things that are coming in the future. The State of the World's Nursing Report, as Amelia said, we're involved with that, supporting that work. Nursing and midwifery in crisis, it harks back to the stories we've just heard of Sudan. And, some of you will know I'm half Sudanese. My father is from Sudan. So I'm doing a lot of work, both personally and within my role here around Sudan. But we're thinking, or we are going to look at this in a bit more detail globally in crisis as a item moving forward as a program of work. Next slide, please. Okay, stay connected. Retweet us, follow us on X, look at us on Facebook, LinkedIn, spread the word. We want more people, more members. We want to really let the world know Nursing Now Challenge is a place for you to be part of, is something that needs to be listened to and can work with others to affect change. So thank you so much. I think that's me done. And I think we're maybe on for the next who's up next, which I'm just going to have a wee look at my little Amy Staley. Amy Staley, the floor is yours.
Thank you so much, Aisha, and thanks for the beautiful introduction about the Challengers Committee. Good morning, everyone. My name is Amy Staley, and I am a proud registered nurse. I was introduced to the Challengers Committee in 2021, and I was actually invited into a virtual event just like this one. Many say that nursing is both a science and an art, and with less than 2 years of experience as a registered nurse, I had a very specific portrait in my mind of what I wanted my future practice as a nurse to look like. I wanted to meet every patient and have them gain something from being under my care. I didn't feel the need to be an influencer like other young nurses I saw on social media, but I knew that I wanted to influence care in a way that was meaningful. I wanted to add value to each room that I entered and introduce myself as Nurse Amy, registered nurse. I sought out opportunities in pursuit of being a part of something bigger without realizing that I was already a part of something bigger. A community of thousands of nurses from over 91 different countries with individuals like Ernest, Harriet, and even Aisha and Amelia, all of whom are meaningfully, mindfully, and artistically shaping the nursing profession by amplifying and empowering the voices of nurses all over the world. So like you heard from Aisha, the Nursing Now Challengers Committee was constructed for nurses by nurses. We are composed of the 6 WHO regions, so I'll give you a little brief talk about each one. So as many of you might know, Africa is home to approximately 400,000 villages, and it is also our largest region within the Challengers Committee. From Zipporah and Mohammed, who advocate for vaccine equity, to Maureen and Cecilia, 2 educators whose expertise develops new nurses in both education and clinical spaces. We also have 1 member from the African region, of course, who received an award for advancing maternal and child healthcare in Uganda through her very own community-based organization created to provide sexual and reproductive health guidance to adolescents and young adults. And you will have the privilege of hearing from this transformational nurse and artist, Harriet, today. Our Americas region is influencing care on a global scale too. As Aisha mentioned, Amy proudly serves as the United Nations Youth Representative. This region is home to nurses from Barbados, Canada, the United States, all of whom who are working on bridging the gap between both local and global nursing. Our Southeast Asia region is home to Ernest, an incredible nurse leader who is working diligently to benefit the field of mental health and well-being for both his patients and also nurses throughout the world. His ability to build trust and partnerships through connections that he's developed is truly an asset to both nurses and patients who cross his path. Our Western Pacific region is writing history, quite literally. Co-chair of the Western Pacific region, Erin Sung Po, recently published a peer-reviewed article which analyzes nursing education for male students in the UK and Taiwan, with fragmented frameworks of gender. And despite being our newest co-chair and our smallest region, Erin has played a profound impact in building up this region and amplifying the voices of Western Pacific nurses. Our European region is driving the delivery of care by gaining insight into policymaking and nurse leadership. This region has worked diligently to promote the State of the World Nursing Report 2025, promoting the recruitment and retention of nurses all over the world. Andres, Malgorzata, Floriana, and Lincoln are 4 names that you will certainly want to remember, and certainly 4 names that I think will change those statistics that we heard from Amelia earlier this morning about nurse leaders in global health. Their research and innovation have reached countries that they have yet to even enter themselves. And last but certainly not least, our Eastern Mediterranean region is led with pride by 2 of the most powerful women and nurses in the world, Sana and Zaid. The leadership of this region travels far beyond the Eastern Mediterranean. On May 23rd, 2023, Sana shook the portrayal of a registered nurse by changing out of her scrubs, stepping away from her role, and traveling to the 76th World Health Assembly to advocate for the protection and investment of nurses and midwives. Sana is all of us. Each of these individuals, Harriet, Ernest, Amelia, Aisha, and even myself, we are all a part of a bigger portrait that is only visible to those who are brave enough to take on the challenge of change. Shortly after joining this committee in 2021, I too, as an early career nurse, was provided with the opportunity to take my advocacy from the bedside in New York City to the United Nations General Assembly. Next month, just 3 years later, I will return to several of these UNGA side events here in New York City. However, this year will be different, as I will return with a new title alongside nurses that I am privileged to oversee, develop, and empower. Since joining this committee, I have earned my master's degree from Columbia University, experienced 3 promotional title changes, and have been provided with more opportunities than I can fit on my resume. I say with full confidence that being a part of the Nursing Now Challengers Committee holds far more weight and value than any title I've ever held in my lifetime. The portrait that I once saw of my practice as a registered nurse is far more vivid, animated, and creative than anything I could have constructed myself thanks to this community. When I envision the future of the nursing profession now, I don't just see myself, I see each of you. You are influencing care in your communities, hospitals, and villages in a way that is far more influential than anything social media could ever measure. You add value to every room and space that you enter, including this one here this morning. And in just a moment, you'll gain insight into the worlds of my incredible colleagues, Harriet and Ernest, who, just like me, await the opportunity to meet somebody as powerful and impactful as you. So if you too hold a desire to be a part of something bigger, I invite you to extend your interest and join us as a member of the Challengers Committee. So thanks so much for having me. And with that, I'll pass it along to our next speaker, which I believe is going to be Harriet.
Thank you very much, Amy. It's always a pleasure to see your faces, to see everyone coming on board to network with Nursing Now Challenge. My name is Harriet Naiga. I'm a midwife from Uganda, and I'm one of the success stories of Nursing Now Challenge. How did I come to know Nursing Now Challenge? That was 2019, where I was selected as one of the innovative midwives. And I represented my country at the World Health Assembly by Nursing Now Challenge, where I got to interact with everyone in the Nursing Now Challenge, WHO, and all the global stakeholders. What do I do? Well, I have a bachelor's in midwifery, and I have just attained my Master of Science in Section Reproductive Health Policy and Programming from London School of Hygiene and Tropical Medicine. I'm the founding director of Midwife-Led Community Transformation, MILCOT in brief. And what we do is to bring midwifery services closer to the community through preventive initiatives, where we focus on prevention of teenage and unplanned pregnancies among marginalized adolescents and young adults. So we have a number of programs at the organization where we have health and survival, we have capacity building for midwives and nurses, where we train them in leadership and also giving them the capacity to provide adolescent-friendly sexual and reproductive healthy services. We also have entrepreneurship for marginalized adolescents and young adults and the entire community, where we do provide vocational skilling. And we also have social enterprises program, where we deep down into the businesses supporting the marginalized adolescents in establishing businesses just to develop them holistically. That is what I do. And how have I engaged with the Nursing Now Challenge? When I got to know about Nursing Now Challenge in 2019, definitely it appeared as a great opportunity, because by then I was just completing my degree in midwifery. And because I had interest, I had started my organization of supporting marginalized adolescents and young adults. And I only wanted something that would expose me to the world, that could see my ideas, that could support me. And we had really less opportunities. And Nursing Now, that is the time Nursing Now Challenge came in. I just fitted into it. And how I was supported, exposure was very, very crucial at that point in life, in my career. When I got exposed, I learned to network, I learned to partner with global stakeholders, and that was amazing. Myself meeting Dr. Tedros, the WHO director, that was amazing, speaking to him. And also we were introduced to the WHO staff. We had to visit them at WHO in Geneva, And that was amazing to hear what WHO points at as the global challenges and where we can fit into in making a difference. We also had an opportunity as an organization to partner with Nursing Now, being sponsored by Badet Trust for Nursing, where we received funding that supported our programs in developing the capacity of nurses and midwives in leadership and in provision of adolescent-friendly sexual and reproductive health services. We also had an amazing visit of Nursing Now Challenge at our offices here in Uganda. That was amazing. So everything that happened in my steps in my journey with Nursing Now Challenge was just amazing and was taking me to another step, to another step. So also, I had an amazing opportunity and interacted with Her Royal Highness, the Duchess of Cambridge. It was a great exposure. She wrote an article herself after our interview, and this spread around the world, and I became a global celebrity by then until now. And also we had global sessions just like this, where I have got to interact with a number of nurses and midwives in the world. I'm so glad and happy that many of them have interacted with me, have benefited from my idea, from my experiences. So I strongly believe that many of them have learned from my experience, and where we are going is really bright. So even my opportunity of getting a scholarship of Master of Science in Sexual and Reproductive Health from London School of Hygiene, it all stems from this kind of exposure by Nursing Now Challenge, because I happened to get 2 scholarships at the same time. The one from London School of Hygiene and Tropical Medicine, and another one was to study Master of Science in Global Health by Commonwealth. But I had to let one go and another person benefited from it. So right now, where am I? Well, we have had quite a number of achievements. What she mentioned, we won the Award of Excellence in Advancing Maternal and Child Health Care during the Heroes in Health Awards 2021 by Ministry of Health. I also won the Award of Innovation by Nursing Now Challenge. And just of recent, I just won the award by Aga Khan University, East Africa, as the distinguished Aga Khan University alumni. So that has been a very, very amazing. Where am I and where am I going? Still, I'm in the community. I'm empowering people. I'm empowering adolescents. I'm empowering nurses and midwives just to learn to advocate for the challenges that we do have in the communities, just as Amelia mentioned. I'm also supporting midwives and nurses to get to the community, just to try and move from the clinic setting and we reach out to the community. So what we do, we facilitate lower level health facilities, and we work with them as we extend the services to the community. The biggest achievement that I was looking up to was to make the services sustainable. And how we got this is to have an opportunity to partner with VACA Health Foundation, that is an organization that supports health workers in Africa. And these have helped us to establish a healthy facility called Milcott General Clinic. And this is what I am running now. We are providing a range of services from maternal and child health, general nursing, and also through community outreaches. So this has been a very, very great highlight, because we can do much work, but sustainability is the biggest challenge. So this is where I'm standing as an entrepreneur. I have experienced growth, and this has been done by VACA Health Foundation, and we are still on our way moving forward. Other engagements I have had with the globe, I'm also part of ICM, International Confederation of Midwives, and this is a very significant support that I have always got from them. I'm a former young midwife leader with the International Confederation of Midwives. I have also mentored the young midwife leaders on a global stage, and we are still moving together we always meet in global and regional conferences, and I really feel happy to meet any of you there. I think I will not share much. I have just put everything together and quickly, but thank you so much, Nursing Now Challenge. I just can't tell how everyone who might have the opportunity to join Nursing Now, how you will benefit. Thank you so much, Aisha and Ami, everyone. Bye-bye.
Mhm. Oh, wonderful, Harriet. Wonderful. Thank you so much. And I know that the person that springs to mind is Lisa Bayliss Pratt, who was the program director before me. And, you know, the work she did, I know she was a great support to you, Harriet, and everyone else also, and is part of the success story. And Harriet, I think you're a prime example, like Sana, like Ernest, like everybody, Amy, that, you know, we create the space and you do the business. And that is it. I think that's it. Nurses don't really need a lot. They're already amazing. We are already amazing. The job of nursing requires in midwifery. I mean, if you said to describe to somebody what our job is, they would just be in awe. So we are already amazing. It's just we need a space and we need encouraged and we need people to say, on you go, we are with you, we will hold you, we will give you these opportunities rather than shutting the door on you. And you have just done the most amazing things, Harriet. I remember the first time we met in Geneva, all those years ago, and you were talking about, I've got this idea, I have Milcot, I've started doing this thing, and look at you now, just absolutely stunning, wonderful. And, you know, people are saying, Harriet, I'm proud of you. Thank you for never giving up and always pushing through. Your story is an inspiration. And we've got Melissa, who's just joined today, and she's put, wonderfully encouraging story. I have found my space. Oh, that is it. Melissa's joined us for the first time and she's listening to this and she's found her home. This is what we offer. This is coming home. And you will always have a place here. So let's hear from, I know we're running over, but it's so wonderful and we very rarely get the chance to be together. So please stay if you can. We are recording it. Ernest, over to you.
Thank you, Aisha, and thank you, Harriet, for what a wonderful testimony that you shared about your life. So, a very good morning, afternoon, and evening to everyone. My name is Ernest Lamwell, and I am honored to serve as the co-chair of Southeast Asia Challenges Committee alongside Rahul, Yugwen, Jamyang, and Adinda. And I work as a mental health nurse from India. I'm excited to share my journey with the Nursing Now Challenge and discuss the plans that we have in place for Southeast Asia Hub. My involvement with the Nursing Now Challenge has been transformative, both professionally and personally. Since joining the initiative back in 2021, the uh, initiative promoted to the co-chair of the Southeast Asia in 2022, I have been deeply inspired by the collective drive to uplift nursing as a profession globally. The challenge has provided me with opportunities to connect with nurses from diverse backgrounds, share best practices, and advocate for the role of nursing in shaping healthcare systems, especially with Dr. Pamela Cipriano, President at International Council of Nurses, and Dr. Amelia, Chief Nursing Officer at WHO last year, where I expressed the current issues faced by the nurses on a daily basis in the Southeast Asia region. The sense of community and shared commitment to making a difference is what truly sets the Nursing Now Challenge apart. Now, as a co-chair of the Southeast Asia Challenges Committee, my role has been to collaborate with fellow leaders in the region to drive initiatives such as the Indian Nursing Council and the Trained Nurses Association of India that align with the goals of the Nursing Now Challenge. Our committee has focused on creating platforms for young nurses to voice their ideas, share innovative practices, and contribute to policy discussions. We believe that empowering the next generation of nurses is crucial for the future of healthcare, and our work aims to support the vision. Now, looking ahead with the Southeast Asia hub that has ambitious plans, our primary focus will be on certain specific initiatives such as a regional campaign, and a series of workshops, or maybe a collaboration with healthcare institutions in the Southeast Asia region. Now, we tend to aim to three major components, which are enhancing collaboration, advocate for mental health, and leadership development. Now, in terms of enhancing collaboration, we plan to foster stronger connections between nurses and across the region by organizing virtual and in-person events that encourage the exchange of knowledge and experiences that the WHO CNO just talked about a couple of, I think, 30 minutes ago. So that is what we are focusing on. Now, in terms of advocacy for mental health, given my background in mental health nursing, we will place a significant emphasis on mental health advocacy, raising awareness and improving access to mental health resources, both for nurses and the communities they serve. And in terms of leadership development, we will continue to support leadership development among young nurses through mentorship programs, training workshops, and opportunities to take on leadership roles. By doing that in collaboration with the training centers and the nursing institutions in Southeast Asia region. And now, coming to our ultimate goal, it is to create a resilient, well connected, and empowered nursing community in Southeast Asia. By enhancing collaboration, advocating for important issues like mental health, and fostering leadership, we hope to contribute to overall improvement of the healthcare outcomes in our region. Now, we believe that by empowering nurses, we are also empowering the communities they serve. Now, in closing, I want to express my gratitude to Nursing Now Challenge team for this opportunity to share our plans. And I'm excited about what the future holds for Southeast Asia Hub and I look forward working with all of you to make a meaningful impact. Thank you. Thank you, Aisha. Thank you, Amy. Thank you, Hannah. Thank you, Faye. Thank you all for allowing us to share our initiatives and what we have planned for our region. Thank you. Thank
Oh
you.
my goodness. I mean, every time we have these events, it just blows my mind. It
Exactly.
absolutely blows my mind. Ernest, I've always called myself a frustrated mental health nurse. And
I know, I
because
understand.
a lot of my work's been involved with alcohol, criminal justice,
Exactly.
drugs,
Yes.
etc., public health. But I'm always so interested in the people that we engage with and why, and and I love listening to you, and I'm so grateful for what
I
you're
am
doing with the region.
grateful as well. Yeah,
I
thank
mean,
you.
just joyful. Like, when you were listening to every day the news, and it's just so demoralizing often. And we
I
come
I
here
believe you might have
together.
heard about what happened in India as well a couple of weeks ago.
Yes, yes. It breaks your heart. And
It
today,
breaks
this
our
morning,
hearts seriously.
this is wonderful. This is what we need to try and focus on and helps us get it
Exactly.
through, because we are making a difference. You're making a difference. And it's just absolute joy listening to you. Thank you so much. It's,
Thank you for having
Amy,
me. Thank you.
Harriet, Ernest, just the comments are just wonderful. And thank you for everything you're doing. It's great. It's just a very humbling, because I don't do anything. It's you that all do it. I mean, one day I've got imposter syndrome. I'll be found out. But I am very grateful for you all. And it's just a joy for me to be even involved in this. It's the best bit of my job. I love it so much. Okay, we have overrun, but I don't know. This was worth every minute, and every second, and our day is going to be happier as we move forward after this. Are there any final questions that people have, who have joined us today? There's just so much love in this chat. Nala, yes, mental health is highly needed for nurses and healthcare workers. Absolutely. if there are no other questions, then I think it's just up to me to say a huge thank you to everyone who has joined us and taken the time. We always get lots of people signing up, and then there's a smaller number actually join us, which is not something we are worried about. We welcome it. We know people are very busy and we record the sessions. I think my ask to everybody today is, please just share this with your colleagues, because we know that nurses, midwives, health workers out there are hugely challenged at the minute. And for them to have somewhere or something or someone in their local area, their region, that will offer some kind of support, assurance, and a safe space, and just a space where someone is offering you something that is positive, and someone is listening to you, and someone cares for you, and someone wants to see you flourish and develop. And that is what this place is for. It's for you. And we don't really have that. We don't really have that in nursing. There are few places, and the nature of our work is the emotional labor of that is huge for us. And I don't practice anymore, but I see my colleagues, I see what you're doing every day, and the weight of that is heavy often. And still, despite that, you are pushing forward with a moral compass, an authenticity that I so wish many policymakers and politicians today could have. And less conflict, less fighting, more love, more care, more cherishing, more heart, and the world would be a better place. You know, and there's a film, there was a short film clip of Tedros, Dr. Tedros. I think it was at the Economic Forum, or it was something like that, maybe in the Middle East. And it was just one of the most powerful things I'd heard about the cost of war and conflict. And when governments say there's no money, there's no this, there's no that, but there's money for conflict, there's money for arms, there's money for things that are bad for us, that cause great, great harm, cause death, destruction, and for the health workforce, particularly, and women and children. And despite that, we are still going. Nurses and health workers, midwives are still going daily into their jobs to look after and care for the communities. And I can't thank you enough for that. So I hope today has offered some remorse or some reassurance or some positivity to you that Nursing Now Challenge exists. Amelia came to speak to you. She took the time. There is WHO, the Community of Practice. There is ICN. There are these organizations that are trying and pushing. But what we actually do, I think, is a little bit different. We actually offer that safe space. We offer development for you. We offer everything from, I'm a nurse, I don't have time. I'm a midwife, I don't have time, but I'm getting these emails, these messages. It's telling me what's available. I can maybe spare an hour or half an hour, and you're still part of it, right up to someone like Ernest or Amy, who are actually taking on more leadership roles within Nursing Now Challenge. We deal with the whole spectrum. No one is excluded. So you can all be part of this. You can just come and listen. If that's all that you can manage, that is fine. We want you. So I'm going to just end today on that. Thank you so much. This is our mission. Let's keep going with it. Let's get these. Do you know what I think? We have a big community, and it's about to get. It is bigger. It's bigger once we make our announcement. But let's make it bigger. Let's make it so big that people cannot ignore us. People cannot no longer not listen to what you have to say. And we are really working hard to get these regions active. And Ernest he's just talking about what he's doing in his region. Amy has got this whole global vision of what the regions are all doing and leading that. It's just absolutely wonderful. And we are at a pivotal moment, I think, of really getting this thing smoking, as they would say. In American movies, maybe, not actual smoking. So let's do that. Let's just make that happen. Let's not wait. Let's just make it happen. Okay, have a wonderful Thursday. Thank you so much. See you soon. If you want any good medicine, this is the medicine you need to take. Okay, take care. Thank you so much, everyone. Have a lovely day. See you soon. Sign up for book club, sign up for Nursing Now Challenge, share with your friends, watch the videos, and have a great day. You're doing wonderful, and we are so grateful for everything you do. Take care. Bye-bye.
Bye,
Bye-bye.
Aisha. Bye,
Bye,
Amy.
everyone. Bye. Bye.
Bye.
Bye.
Bye.
Bye.
Bye.
Bye.
Bye, Hizu.
Bye.
Bye.
Yes.
Bye, everyone.